What a pleasure to be with all of you here today, and welcome. This morning we're going to be looking at the very important topic of overcoming barriers to change, problems in the system. For more than 20 years, I've been following breast cancer research, first for myself when I was diagnosed, and then for all the women and men I've come to know and love who are living with breast cancer, whose lives depend upon it. I'm an optimist by nature. Inspired by the dedicated researchers I've been privileged to know and work with over the years, I've managed to remain hopeful despite all the losses, despite the slow pace of progress. There are rewards for a research advocate, after all. The learning, the collaboration, the excitement of having a front row seat. It can be exhilarating to attend scientific meetings, as many of you know. Especially Era of Hope, the conference at which DoD-funded research is presented, and to hear from all the enthusiastic and gifted young scientists. The researchers I've worked with genuinely care. Of that, there is no question. In their labs, they work creatively and carefully, validating and replicating their findings before they publish. But they spend an obscene amount of time writing grants to support their labs, or fighting for the clinical trials that will make a difference to patient care, only to see them mired in administrative detail, accruing slowly or not at all. They work within an inefficient system, increasingly driven by commercial interests, a system that perpetuates mediocrity, rewards careerism, and discourages the publication of negative findings. I see an industry that is not surprisingly, for the most part, avoiding risk and focusing on marketing their products as widely as possible. I've seen the hype attending the release of each new drug. In my time as an advocate, more than 24. And I have also witnessed the disappointment patients feel when the miracle they hoped for fails to materialize, and there is disease progression or difficult side effects. I see a profit-driven healthcare system overtreating some, undertreating others, adding on drugs that offer marginal benefits at barely affordable costs. And yet the picture is not all bleak. Today, breast cancer research has brought us to a level of complex genomic and epigenetic knowledge undreamed of when I was diagnosed. Some real successes have arrived in the clinic. The targeted antibodies, the hormonal therapies. Mortality rates for early breast cancer have decreased by nearly a quarter, if you happen to be white and well insured. Overdiagnosis and unnecessary treatment have also increased, although this is rarely spoken of. For women whose cancer is spread, improved supportive care can stop bones from dissolving and breaking. There are better drugs to control nausea, pain, and fevers. These can help to make life in treatment bearable. But should we really be satisfied that the women we love are living a few months or a year or two longer when we are still losing them all? Some improvements have come about because of less treatment, not more. Sentinel node biopsy is better at avoiding lymphedema and nerve loss than full axillary dissection, which I had. Radiation is more targeted, avoiding normal tissue, and many patients do not have to endure chemotherapy as a result of multi-gene testing that predicts risk of recurrence. These are advances, and they are real, but they are not enough. When I was diagnosed, I was 47, and next year I turn 70. I am tired of waiting. I am tired of hoping, and I'm tired of losing the women I love. It's time for new research strategies and new collaborations, and with Deadline 2020, we are well on our way. So this morning, you'll be hearing about some of the problems and barriers that plague cancer research, including an example of outright research fraud. You'll learn about cancer clinical trial system that is struggling to stay afloat, about published and peer-reviewed basic research that cannot be validated or replicated, and certainly not translated into anything that will help patients. It's pretty disheartening to look at all this. It shakes our confidence, I know. But I have to believe that a clear-eyed examination can lead us to solutions and new ways forward.